Scotland is now 4 years into what its former First Minister Nicola Sturgeon called a drug death public health emergency. Now the city of Glasgow is trying a radical new solution by opening a drug consumption room. It aims to provide a safer environment for people to take drugs in the hope of reducing deaths. So can this reduce Scotland's high rate of drug-related deaths? Well, I'm Charlene White, and this is what you need to know. Welcome to our latest quick briefing, where I'm joined by our correspondent, Peter Smith, who's been looking at this issue for quite some time. Thanks for joining us, Peter. Can you explain to us exactly what a drug consumption room is?
Yes, well, it's a concept that falls under the remit of what would be called harm reduction. So it's essentially about saying people are using drugs anyway. The war on drugs, about trying to eradicate drugs from our streets, is evidently not succeeding. So if people are using drugs anyway, what can be done to try and reduce the harms that they're doing to themselves and to communities that they are in? And that involves essentially these drug consumption rooms creating a safe, clean environment for them to bring their drugs, or in some countries around the world where they would be prescribed the drugs at location that they'll be using. They'll be provided with clean equipment to inject. Again, in some drug consumption rooms around the world, they'd be smoking drugs as well, or snorting. And they're given that clean environment, the clean equipment. They would be under supervision of a nurse or a healthcare professional. If they experienced any health complications, like an overdose, then there could be an attempt to resuscitate them, and that's been really effective. There have been really few deaths in drug consumption rooms around the world, despite thousands of people who have been using them over a long period of time. So if people are experiencing an overdose, it can save lives. Also, if people are injecting into wounds and whatnot, that can be identified. They can be treated for that. It can save people's lives. It can save limbs, and it also stops the spread of bloodborne viruses. It's there's evidence that it has reduced the spread of HIV in some places because it's prevented needle sharing. The needles are given clean needles, they're disposed of safely afterwards. And so that's essentially what we have. The UK's very first drug consumption room, a place where you can take your drugs and you will not only be given a free pass, you'll be actively encouraged to go there to take your drugs under supervision, with the idea being it will be safer for the drug user and the community around them, with fewer needles discarded in public areas.
Yeah, I mean, you've talked us through many of the positives of this, but there surely must be some negatives to this idea as well, though.
Well, there would be people who would take a very different approach to what should be done about tackling the issue of drugs. And for example, Scotland's drug deaths public health emergency, which, as you'd mentioned, was declared 4 years ago by then First Minister Nicola Sturgeon. People are saying, well, if you just give people somewhere to take their drugs, yes, it's in a safe environment. It ignores some of the what we could call more holistic problems around that. It ignores the mental health crisis. It ignores the fact that people are in many cases using drugs because they have mental health. They're experiencing a mental health crisis, or they have mental health problems that they're unable to be treated for. They're self-medicating, and if you're not, if you're just giving them a place to take their drugs, that's just kind of treating the symptoms. You're not actually getting to the core of the problem. Also, if you don't give people an opportunity to access other services to get better, for example, like rehabilitation beds, where they could, if they wanted to, come off drugs altogether, then all you're really doing is giving them a place where they can continue a harmful, self-harming habit until they're no longer with us to do so. And in that case, you could say, well, that's not providing people with hope. That's just kind of prolonging people's pain. So there are people who would take a different approach and say that there should be more effort put into getting people better, getting people off drugs altogether. And also there's a hardline approach that says they shouldn't be encouraging the use of drugs anywhere, because even with the drug consumption room, there's no change to the law as such. Drugs are still illegal, or the drugs that we're talking about here, like heroin and cocaine, will still be illegal. It's just sort of turning a blind eye, as it were, giving a free pass to use it in one specific location. The other potential downside there, of course, is we've seen in other places that have had drug consumption rooms, is that they can become a magnet for crime. If you have an area where it's known there will be people carrying drugs into a clinic. Other drug users can start to surround that area, whether there'll be robberies or people robbing them of their drugs, people asking for drugs. It starts to become an area where drugs are sold, attracts dealers, attracts crime, attracts pushers, and then what you have is essentially a kind of ghettoised drug zone within a city. Now that's obviously a risk that Glasgow is taking in creating this zone. It's just on the outskirts of Glasgow towards the East End, just between the city centre and the Calton area of the city. But of course, this is the evidence says that there is overwhelming evidence of health benefits, and that's why the Scottish Government has been pushing so hard to get this pioneering clinic open to see if it can make a difference to those drug death figures and also the wider health issues and drug harms that surround it.
Now, obviously, I mean, all of this is based on actual evidence of where else these drug consumption rooms have been opened. Because, yes, it may well be the first in the UK, but as you mentioned earlier, it's not the first in the world, is it? So where else have these rooms been tried? Well,
they've been well established in Canada, in Australia, across Europe. In fact, I went with ITV News in 2018. We visited one of these drug consumption rooms in Copenhagen in Denmark. We saw how effective it was. Again, after the drug consumption room opened in Denmark, the HIV rates in Denmark plummeted to one of the lowest in the world. They said that needle sharing was almost eradicated. They said they were able to sort of, if you're engaging with a community that's pretty hard to reach, the drug using population, we're talking about some of the most at-risk drug using population on the fringes of society, often people who are homeless. It's maybe been a very long time since they've seen a GP, since they've seen a dentist, which can lead to a lot of other health ailments and health problems. And so in that drug consumption room in Copenhagen, they said the focus was on early intervention, not just for giving them a safe space and a clean space to use their drugs under supervision, but to try and engage people back into the health system so that they could have early intervention to prevent other problems that they'd be having, whether it be physical health or mental health. But again, that comes back to the issue. In Scotland, there is a lengthy waiting list for mental health support, and often people are being told they can't access mental health support if they're on drugs, and they can't get off drugs if they can't get into rehab clinics, and there are too few funded rehab beds for the drug using population.
And you've been talking to people about this, haven't you?
Yeah, that's right. And we wanted to gauge how effective this was going to be, but also how popular it was going to be. How likely is it that the drug-using population in Glasgow are going to use it? Now, I have to say as well that the location of the Glasgow drug consumption room is pertinent, because in other countries, they're smack bang in the middle of a city centre. This drug consumption room, the one pilot that's been opened so it's just towards the east end of Glasgow, it's not in the city centre, and there are concerns that are people going to make that journey to use it there. Now, also, it's specifically located there because there are a few homeless hostels in that area. It's well known that there's a lot of drug paraphernalia around. Anyway, we spoke to one man called Billy. He agreed to talk to us, and he told us about his experience with drugs, and here's what he told us.
I am 42 years of age. I've been taking drugs for 30 odd years. Heroin destroyed my life, it destroyed my leg. I can't see myself personally get in there, no. But you want to take your drugs as soon as you get them, that's what I'm saying. You won't come all the way up here once you've scored in city centre and want to use a consumption room.
Now, what Billy is saying there, he's experienced overdose in his life and he's survived it, but he has lost a leg through the use of heroin he was injecting, he said, into the same place over and over again, a wound, an abscess. He ultimately lost his leg from the hip down, and he's now wheelchair bound. And Billy was telling us there that if he scores his drugs in the city centre of Glasgow, he's not going to take a bus or travel all the way to that clinic towards the east of the city. He says he wants to take the drugs instantly. It's a habit, it's a necessity. He's addicted. So he says he would be looking for the nearest car park, alleyway, wherever he could go that would be quiet, and he could take the drugs to satisfy his addiction as quickly as possible. And he said he couldn't see other people making the journey to the clinic. Now, that's a scepticism about the location. That's not to say it will not be used. It might just target a very specific drug-using population, about 300 or 400 people in that specific area of Glasgow, and it's also just in one city. So we should perhaps limit expectations about how effective it's going to be in reducing Scotland's overall drug death crisis in the national picture.
Yeah, so what's the government been saying in terms of what sort of impact they're expecting this to have then?
Well, this has been an interesting one because it has actually come about after a political battle. Westminster has consistently blocked drug consumption rooms from opening up, and it needs permission from Westminster because the Misuse of Drugs Act, which is the legislation that covers things like drug possession, buying drugs, is reserved to Westminster. The Scottish Government does not have power over that. This has taken a lot of negotiation, a lot of back and forth, and Scotland's Lord Advocate, essentially the head of public prosecutions in Scotland, saying that she has just published a prosecution policy saying that if people are in possession of drugs in this drug consumption room in Glasgow, in this one specific zone, then it would not be in the public interest to prosecute, and she would advise against prosecutions. That intervention means that this is possible, and the UK government essentially is also turning a blind eye to allow this pilot scheme to go ahead. And so it's been a long fought out battle. Finally, we're getting this one drug consumption, the first of its kind in the UK, and there is huge pressure on it to deliver, essentially, because the Scottish Government is on their watch, on the watch since the SNP came to power in Scotland in 2007. It was after that Scotland's drug death crisis emerged. It was about sort of 2014, 2015 that the drug deaths started to spiral out of control, going higher and higher and higher. Say Nicola Sturgeon declaring that public health emergency, and it hasn't made a difference. So they admitted previously that they took their eye off the ball when it came to drugs in Scotland. They are saying that this pioneering scheme is going to make a difference, and they've invested money in it. I spoke to Scotland's First Minister John Swinney today just to see how confident he is about its effectiveness.
What this facility is about making sure that people who are in crisis in their lives, who are going to take drugs anyway, and we know that, to do that in a safer environment with better clinical support and access to advice and support to take a different pathway in life. And there are other services and support available to them in that context.
I mean, you've talked about the fact that this may well just target a small number of users, but also you've mentioned about the fact that it's about so much more than this. They can't access, for instance, mental health services that they may well need. So what else is the government doing about the issue in that case?
Well, the Scottish Government is saying that they are investing in housing, they're investing in mental health support, they're expanding the access to rehab beds, but people would say it's too little too late, essentially. It's long overdue. That's the criticism of the Scottish Government, that this is a public health emergency that we're 4 years into, and things should have improved long before now. And many of these things, say, waiting for the drug consumption room was something that was out with the Scottish Government's control. They didn't have the powers to do that under the powers of devolution. But there were many other public health approaches that they could have taken much, much sooner, improving access to rehab, looking at the methadone harm reduction programme's effectiveness and making it, is it tailored to people's needs? Is it working for everyone? Is it actually harming people? Because the majority of people who are dying in the last few years of Scotland's drug death statistics are dying with methadone in their system. So potentially, not all of them, but a large number of them will be people who are already part of the system, supposed to be being treated for their addiction. But what they're doing is they're leaving and topping up with multiple substances after visiting their pharmacist in the morning. They're topping up with street Valium, they're topping up with Etizolam. Sometimes it's injecting cocaine, which is hugely on the rise in Scotland, and it's led to people needing to inject much more frequently. And sharing of needles has become an issue as well, combining that with Scotland's well-known alcohol problem. And sometimes people are not dying, by and large, in alleyways. They're dying behind closed doors, hidden away from the public eye, often in their own flat or a friend's flat, and they're not able to be saved. So it's a societal issue in Scotland that has escalated to a degree that we're kind of fighting an uphill battle now in Scotland to kind of return from, 10 years ago, Scotland was not the drug death capital in Europe. It has been well established as the drug death capital of Europe for quite a few years now. And the question is, how does the Scottish Government reverse that, and have they used the powers they had at their disposal quickly and effectively enough?
Peter, thank you very much for that. Well, you can watch Peter's full report and read more on this story on our website and on ITVX. And do continue to have a listen to our latest quick briefings to find out what you need to know about a range of headline topics. But until next time, thanks very much for listening.